Good morning, I'm Dr. Regina Hardin, owner of My Kids MD Pediatrics, your personal pediatrician, and I help families handle their most common pediatric concerns, ADHD and IEPs, with less worry and more confidence so that kids are healthy, happy, and thriving. I wanted to talk with you today about 3 tests that your newborn will receive after they are born at approximately 24 hours of life. So the first one we'll talk about is the hearing screening. So your newborn will have the hearing checked, and they will let you know if the baby passes or fails. If the baby fails, then the pediatrician will get that information, and then the screening will likely have to be repeated. But a lot of times they fail because there's fluid in the ears. So once that fluid clears, a lot of times they will pass. But again, if they don't, then that might mean that there might be a problem with the baby's hearing, and then the appropriate referrals will be made. The second screening that the baby will get is the congenital heart disease screening. And with that screening, we are testing the amount of oxygen in the baby's blood. And this test is done at 24 hours of life at least. And then what we will do is we will place a probe on the baby's right hand, which is preductal. And then we'll get a reading, and then we'll place this probe on the baby's foot, and then we'll get a reading, and then we compare them. So if they are about the same and they are 95 or over, great. But if it's less than 90%, or hovering between 90 and 95%, or if there's a difference between what we are reading in the right hand and what we are reading in the right foot, then that might indicate a concern with the baby's heart. And some of those things you won't really know about until, again, the baby transitions from being outside of the womb to being to life outside. And so there are some changes that will be made or that will happen with the baby's heart that we might not be able to see, but we might be able to get some idea by doing the congenital heart screen or by measuring the baby's pulse ox. And that will be with a machine that looks similar to this, or it might be with a bigger tabletop machine that they would usually have in the hospital. Now, the last thing would be the newborn screening. So with that one, we get the baby's foot, and we take a look at the baby's foot, and then we look at the outsides here. We'll take a little lancet that's similar to this, and then we will prick the baby's foot. So once that happens, they will wipe off that first drop of blood, and then they will get a card similar to this. It has 5 circles on the end, and with the blood that's dropping from the baby's foot, we will go ahead and we will fill the card, fill those circles, and then we will send that for testing. Now, the pediatrician will check for these results, and again, if they are abnormal or if they didn't get enough sample, or perhaps they did it before the age of 24 hours, your pediatrician might have to have it repeated. So those are the top 3 tests that will be done, and the baby will also have an ointment put into the eyes as well to protect against infection, and also the baby will get the hepatitis B shot, the first one, and will get a vitamin K shot as well. Of course, all of those after consent. If you guys have any questions, let me know. Just leave me a question. Or if there is anything else that you would like to learn about. The next thing that we'll talk about, however, when we meet the next time, will be the newborn exam. So I'll go ahead and demonstrate a newborn exam. All right, you guys have a great day. Take care.